person. Uh, I had three reasons to come to Calcutta. This is almost after 2.5 years that I have come out of Indore, because for otherwise every Saturday Sunday I used to be out of Indore to deliver lecture somewhere, but for last 2.5 years I have not left my house also. So when Gautam invited me, I really felt happy. Second part was very important for me to pay homage to our founder president, Dr. M.N. Parikh, just to make him realize that the seed he has shown has grown so much that after the previous ISAR conferences in Calcutta, now Yuva ISAR is coming to Calcutta, where we are inspiring young people. And the amount of work done by Dr. M.N. Parikh will be remembered always. And the third part was that I want young people to get up, because the theme of this conference is inspiring young persons. I want you to get up and do research work on COVID for simple reason that I remember the incidents of December 1982. It was a very cold night when there was a gas leak at Bhopal from Union Carbide factory. I was the only person who had an ultrasonography machine. I put my machine in my car and rushed to Bhopal, to medical college, and requested the head of the department that let's start screening the pregnant ladies who have suffered, because this type of tragedies do not happen again and again. She refused me. She says, you have to take permission from the Chief Minister, Mr. Arjun Singh. I went to Arjun Singh's office, stayed for a whole day, did not meet him. I sent him a letter. Next day he called me. He made me sit from morning to evening, did not reply me because they were busy seeing that the Anderson runs away from India. Unfortunately, I could not do that work. And today, if we miss this bus, today, of course, the research in COVID is not much of research. It's mainly analysis of collecting data and analyzing data. And I want that office bearer of Foxes are here also. ISAR is also here. And young people are here. Let one of the young take up the project. Tell the ISAR president and Foxy office bearer, and I am there to guide you. It will be a unique project to work on this thing, because you will never get opportunity like this again and again. And that's why I have selected this topic. I hope you will accept it, my challenge. The field of reproductive medicine saw many plants put on hold in the wake of COVID-19. Not much was known about the impact of the disease on the reproductive system, fertility and assisted reproduction. However, with intensification into researching the effect of virus on the reproductive health, insights are slowly emerging to help in the management of reproductive medicine during this crisis and beyond. Everybody woke up, including ICMR, European Society, ISRE, American Society, SRAM, and International Federations of Fertility and Society. They have come out some guidelines. Almost all guidelines are similar, like ICMR guideline. There are some silent features of each guideline separately, which I am putting here, that assisted reproductive facilities should be recommended in the stepwise manner. There was a complete hold of this process because everybody was locked in lockdown. Even we were not getting liquid nitrogen for our cryopreservation work. There were no culture medias available. There were no gonadotrophin supplies. So there was a hold up of the work. But once there was a liberty to do some work, everything has come out in stepwise manner. Patient must be fully informed. Everybody says counseling is very important about the nature of the COVID-19 epidemic and its effect on the treatment and future pregnancy outcome. Patients should know, acknowledge all the facts and give informed consent. It should be the patient's desire that I want to continue the treatment. If patient wants to defer the treatment, they should be explained everything. For example, the patient is with compromised ovarian reserve. You know that she has got very limited time to conceive with her own oocytes. But you have to counsel her thoroughly well that undergoing treatment at this time is risky. The ART clinic should modify their layout, working practice in accordance with national and local guidelines for COVID, and health system should be future rise in the spread of, should prevent the future spread of the COVID in the community. So we are there to, we have to prevent now. Fortunately, in India, we are in much better position. But look at the sudden fifth and sixth wave coming up in America or in European countries and South Africa. It is again threatening. Maybe that we may suffer again. But suppose if we, as an organization, we do not get up today, tomorrow it will be too late. We must be active and to collect the data about the COVID patients and analyze this data and come out with very clear guidelines for future viral infection. And if we don't do, we may be missing the bus. The Israel guideline again says similar things, but they have stressed more on two things. One, that there has to be autonomicity, which everybody says, yes, it should be there. And second, that the patient's treatment has to be individualized. And then they have come out with one more. There is one more part, that the patient who are susceptible for hyperstimulation syndrome should not be treated in COVID epidemic for simple reason that if they go for hyperstimulation syndrome and in case they have got silent COVID at that time or they are carrier for COVID virus, they can end up with serious problem about their lung and kidney failures. So if you are treating the patients and if you are suspecting slightest doubt about the COVID, please do not take up the patient who is susceptible for hyperstimulation syndrome. Then there is a joint statement from IFSS, ISAR, IFSS, Israel and American Society, and it is a global challenge on a scale not previously seen. In the early stage of epidemic, the independent recommended discontinuation of reproductive care except for the most urgent cases. Which are the most urgent cases? The patient who is suffering from cancer wants to get the cryopreservation done. This is urgent because he cannot wait. She is to undergo either chemotherapy or surgery for cancer. And this is an urgent case. So these are the patients who were treated during proper lockdown period also. But otherwise everything was put on hold at that time. More recently, the societies have been sanctioned gradual and judicious resumption of delivery of full reproductive care. And they have come out with 10-point statement that they advocate well-being of the patient, which is important. All the guidelines are otherwise same. Most important has been counsel the patient properly, one thing. Second thing, let the patient take the decision that she wants to continue the treatment. And third thing, that you must follow the national and local state level guidelines and then plan your treatment according to available resources. Do not jump. And at any level of the treatment, if there is a slightest doubt, please stop the treatment immediately. Don't risk the life of the patient because this is a deadly virus. We don't want any infertility patient to die of iatrogenic complication. And do not hesitate to discontinue treatment at any time. How virus affects the reproductive organ? The SARS-CoV virus infection employs the angiotensin converting enzyme S2 receptor in the renin angiotensin Aras system for viral entry into the cell. These S receptors are present in all reproductive organs, and not surprisingly, numerous reports have come about their effect on the reproductive system in the male as well as in female. Although the S is found throughout the female reproductive system, it is mostly present in the ovaries, making them potential target for damage by SARS virus. The downregulation of S2 by SARS entry into the ovarian tissue causes alteration in the normal ovarian physiology, reduces the follicular development, worsens the oocyte quality and oocyte maturation and reduces the fertility rate. Apart from that inflammatory process induced by viral infection, which produces oxidative stress, has got bad effect on the development of the oocytes and embryo. Uterus is also very rich source of this uh, receptors. The RAS complex is also significantly present in the uterus, mostly confined to epithelial and stromal cells of the endometrium. Therefore, COVID-19 damages the endometrial epithelial cells. It may affect early embryonic implantations. Normal level of angiotensin II expression is crucial for maintenance of regular menstrual cycle and endometrial activity, and it facilitates the regeneration of blood vessels and endometrium and initiates the menstrual cycle or helps in implantation. But when it is affected by the COVID virus, the proper vasculitis also happens. The vasculature is not proper and the implantation does not happen. The SAR also infection has been seriously disturbs the such balances and causes the implantation failure. In the fallopian tube, angiotensin II has been found in the epithelial and stroma, and the function of angiotensin II in this tissue remains unclear, but one study reported that it stimulates the ciliary beads frequency in epithelial cells. Of course, the evidences have not come so far, but maybe that the patient who has suffered from COVID, they may come out with higher incidence of tubal pregnancy. In male factor, there has been a lot of studies, lot of publication. I have come across more than 400 papers on male infertility and COVID infection. The male reproductive system, some part of the testes has been found to contain S2 virus, particularly the spermatogonia, Leydig cells and Sertoli cells, rendering them potential target for this virus. The Leydig cells, Sertoli cells and seminiferous tubules also contain angiotensin 1 to 7 receptors. Infertile men with severely impaired spermatogenesis have lower levels of S2 and angiotensin 1 to 7 receptors, and hence these patients also, when they are affected by COVID virus, these receptors they go down and their production of the spermatogenesis and production of the hormones is affected. This leads to complete change in the endocrinology of male reproductive system. There is a significant increase in serum luteinizing hormone level, prolactin level, and among the male patient with COVID-19, a significant decrease in testosterone level and testosterone to LH ratio and LH to follicular stimulating hormone ratio is also disturbed in the patient with COVID infection in male partner. The hypothesis has been present that LH increases the COVID-19 result from the early stage of impaired testosterone production and causes the reduction of Leydig cells. Therefore, considering the risk of clinical hypogonadism developing because of COVID virus as the disease progresses, and it is important to perform follow-up of post-recovery patients for at least 6 to 9 months. In our study, we have already started studying the male partner who had a normal seminal parameters, who had come for treatment to us just before COVID epidemic occurred. And among those patients who did not continue treatment or their wife did not conceive spontaneously, and they have actively suffered from COVID infection during that 1.5 year period, these patients have been called back and we have started analyzing their semen report. And earlier reports are really discouraging to see that quite almost 70% of the male who had a previous normal seminal parameters, their reports are changing to low volume, low count, very poor mortality and increased teratogenic. So these studies we have just started doing in our clinic. I think if at all India level we can come out with some study like this, we can have definitely some guideline. We have started putting this patient on antioxidants therapy and trying to wait to see how much time they take to improve their seminal parameters. We are quite hopeful that they will show some improvement. The semen sample of the patient who have moderate infection were shown to have significant lower sperm concentration, lower total number of sperms per ejaculation, lower sperm number motile sperms, and lower total number of progressively motile sperm than normal patients. In combination with the risk of sexual transmission, the consideration of deferring the conception in recovered patients until more evidences are available should be taken very seriously, because these viruses, they remain in the seminal plasma. They don't enter the cell, so you may not find them in the intracellular compartment. But how long they do remain in spite of patient becoming asymptomatic is not defined so far. And those patients who have suffered, at least we advise them not to have unprotected intercourse for 3 months at least, because that is the time it usually takes virus to clear up from seminal parameters. And then, because we don't know what there can be transmission of this semen to the female partner who was earlier negative. Most recent recommendation advised that sperm donation, cryopreservation of the sperms from the active or recovered COVID-19 patients should be avoided at the moment, as many virus remains viable and infectious when cryopreserved. And this recommendation is come only last year, that till you are definitely sure that the patient is totally virus free, do not even advise them to do semen cryopreservation, because you may infect your cryopreservation liquid nitrogen tank also. Multiple studies have reported a high risk of male patients with COVID-19 developing orchitis-like symptoms, suggesting viral orchitis. As COVID is associated with coagulopathy, the orchitis could have been result from vasculitis. And this vasculitis also happens in the uterus and prevent the implantation. It may produce endometrium hyperplasia also. Furthermore, the possibility of orchitis leading to infertility as a complication of infection with coronavirus is widely accepted now, and it is disrupting that spermatogenesis, impeded spermatogenesis and destroyed cells in seminiferous tubule. In fact, much evidences have been presented that highlight the hormonal changes in patients with COVID-19. The impact of COVID virus on male infertility has been very nicely published by two of the Indian scientists, one Dr. Darshan Patel and another is Nahid Punjani. Nahid Punjani is from Bombay. He is in USA now. There are many questions remain unanswered regarding the short and long-term impact of COVID virus on male reproductive health. Based on the current evidences, likelihood of virus transmission through the seminal fluid is very low, although there has been many reports regarding the viral tropism for the male reproductive tract on important consideration for viral entry into co-expression of both S2 receptors and TMPRSS2 at sufficient level. There has been very limited data on characteristics impact of SARS infection on male reproductive hormone and seminal parameters. Larger scale community-based evaluation of SARS in semen sample and longitudinal collection hormone profile and semen analysis from the recovered men are needed before we can better understand the impact of this virus on male reproduction. This is a guideline from the people who have done extensive study of the infected COVID male partners. The many reproductive care centers resume fertility care delivery globally. Men and their potential partner must be appropriately counseled regarding what is known and what remains still unknown as far as this infection is concerned, and what is going to happen to male reproductive health. So research is needed in addition to helping these patients. The reproductive medicine practice are uniquely positioned to gather this data and help to further COVID research. The reproductive medicine professional and practice are essential frontline resources for screening, monitoring, and assessing and prevalence and impact of the disease on patients and their progeny, because not it is going to affect the mother only, it is going to affect the unborn child and subsequently newborn child also. And this point has all data must be collected properly. ISRE, SRAM and IFSS are committed to continuously monitor the effect of COVID-19 on the gametes, reproductive tissue, collecting data on pregnant patients infected during this epidemic and assessing the outcome of mother and neonates. We Indians also must contribute through ISAR on this data collection. The example of this research and registries are as follows. In USA, ASPIRE, assessing the safety of pregnancy and coronavirus pandemic study, is a national-wide prospective cohort study of pregnant women and their offspring during COVID-19 pandemic. All patients under the care of reproductive medicine specialists who conceive spontaneously or with assisted reproduction between the March 1st, 2020 and December 2020 are encouraged to participate. European Society is gathering global case-to-case reporting on the outcome of medical assisted reproduction conceived pregnancies in women with confirmed infection. Affiliated Society of American Society and the Society for Assisted Reproductive Technology SHART is including mandatory COVID-19 related questions in their clinical outcome reporting system registry of assisted reproduction technology, which accounts for over 95% of all ART cycles in USA. Our Dr. Manish Bankar is one of the part of this SHART study, and we must get in touch with Manish and must collect data from Indian side and must provide proper data for future guidelines. The European Society is gathering data and mapping of MART and ART activity during epidemic counted country by country, whether and or when they stopped offering treatment and what was the ultimately resumed care. IFSS is conducting COVID-19 related periodic survey to assess the global trends in the assessment of medically assisted reproduction and assisted reproductive services. The final thought is reproductive care is essential. Reproductive medicine professionals are in unique position to promote health and well-being. In addition, American Society, European Society and IFSS are collaborating to advocate for the patients and to gather data and resources to enhance understanding of COVID-19 as it pertains to reproduction, pregnancy and the impact on the fetus and the neonates. The lesson learned from this experience will be very useful for humanity deals in the future epidemics. So this is my request. After that, I have got many slides available. These are mainly related with the pregnancies, but my basic talk was only up to this level. I want one of the young generation to wake up, come out with the office bearer of the ISAR, come out with the office bearer of Foxy. Let's plan out some positive research work. These are mainly collecting data and analyzing them properly with the international organizations and come out with something which can be of some help to us in future planning of such epidemics. Thank you very much.